Okay, so this video will be on axial muscles. I am Jane McFarland, of course. So starting at the top, we have the epicranius frontalis, which is a bipartite muscle consisting of frontal belly, which covers the dome of the skull. And the origin is the frontal belly epicranial aponeurosis. The insertion is the frontal belly and the skin of the eyebrows and root of nose. And for the action for this one, it is able to raise the eyebrows with the aponeurosis being in a fixed position. So when someone is confused or anything like that and they raise their eyebrows, this is the muscle that they are using. So next we have the zygomaticus major and minor, and this extends diagonally from the corner of mouth to the cheekbone. And as its name would imply, the origin is the zygomatic bone for both muscles, and the insertion is skin and muscle at the corner of the mouth. And the reason why insertion is at the corner of the mouth is because this is the muscle that we use to smile. It draws the corners upward, and that is how we produce our smile. So next we have the levator labii superioris, and this is a thin muscle between the orbicularis oris and inferior eye margin. And the origin for this one is also the zygomatic bone and the infraorbital margin of the maxilla. This insertion for this muscle is the skin and muscle of the upper lip, and this is what opens the lips and raises and furrows the upper lip. And it is located right there. Next we have the depressor labii inferioris. So this is the opposite of the muscle that we just went over. And this is a small muscle running from the lower lip to the mandible. The origin is the body of the mandible lateral to its midline. The insertion is the skin and muscle of the lower lip, and it draws the lip inferiorly. So this is what you would use to pout, basically, and that's where it's located. Next, we have the depressor anguli oris. So this is a small muscle lateral to the depressor labii inferioris, so it's just slightly farther out. The origin is the body of mandible below incisors. The insertion is the skin and muscle at the angle of the mouth below insertion of zygomaticus, and this is what we use to draw the corners of the mouth down. So this is the frowning muscle, so it's like the opposite of zygomaticus major and minor, and it is located there. So finishing up the muscles of the face, we have the masseter, or as some refer to it, the mass eater. It covers the lateral aspect of the mandibular ramus and can be palpated on forcible close-serve jaws. The origin is the zygomatic arch and zygomatic bone, and the insertion are the angle and ramus of mandible. The action, it is what moves the jaw to close it, and it elevates the mandible, and it is located here as that big muscle. So we have the frontal bone, where the frontalis would be located as the name indicates. And then we have the area where the zygomatic bone is, or like our cheekbone area, where the zygomaticus would be located as the name indicates. And then we have the mandible and the maxilla, where a lot of our other facial muscles around our mouth are located. Alright, and here I've got another picture to review some of our actions. So we've got the zygomaticus major and the zygomaticus minor that draw the corners up to help us smile. And then we have the levator labii superioris that draws the upper lip upwards. Then we have the depressor labii inferioris, which draws lip downwards, as well as the depressor anguli oris, which draws the corners of our mouth down and allows us to frown. Finally, we have the masseter, which allows us to move our jaw, which helps us chew. We open and close our mouths while we're eating. And that is all. So moving down, we have the trapezius, which is the most superficial muscle of the posterior thorax, very broad origin and insertion. And so the origin is the occipital bone, ligamentum nuchae, spines of C7, and all thoracic vertebrae. The insertion is the acromion and spine of scapula and the lateral third of the clavicle. So as you can see, that is a broad origin insertion with all those parts. And the action is that it stabilizes and rotates and retracts the scapula. So this is what holds it in place. As you can see, the muscle connects to it, that's what's holding it there. And then also it retracts it, so it's what lets us move our scapula towards each other, and it extends the head. And this is just a quick picture of the back of a scapula that shows the area where the trapezius is connecting to stabilize it. Moving deeper, we have the erector spinae complex, and this is a long tripartite muscle composed of iliocostalis lateral, longissimus, and spinalis medial muscle columns. Superficial to the semispinalis muscles, extends from the pelvis to the head. It's quite large. The origin is the iliac crest, transverse process of lumbar, thoracic, and cervical vertebrae, and or ribs 3 through 6, depending on specific part. The insertion is ribs and transverse processes of vertebrae, about 6 segments above origin. Longissimus also inserts into mastoid process. So it's that really long, big area, helps us stay erect, which as the name would imply. And it extends and laterally flexes the vertebral column and extends and rotates the head. So to help with the trapezius and the erector spinae complex, so as mentioned, the origin for the trapezius involves the thoracic vertebrae, so this is a thoracic vertebrae, and then the origin for the erector spinae complex is all vertebrae, and so on the transverse process is, so that's what is circled the area for that. Moving back to the anterior portion of the body, we have the rectus abdominis, which is often referred to as the six-pack. It is the medial superficial muscle, extends from the pubis to the ribcage, and is ensheathed by aponeurosis of oblique muscles, and it is segmented. And it's got the linear alba running through it and the tendinous inscriptions. The origin is the pubic crest and symphysis, and the insertion is the xiphoid process and costal cartilages of ribs 5 through 7. The action, so it flexes and rotates the lumbar region of the vertebral column, and so this is what we use for sit-ups, and we use when we rotate side to side. Next, we have the external obliques, and these are the most superficial lateral muscles. The fibers run downward and medially, ensheathed by an aponeurosis. The origin is the anterior surface of the lower ribs, and the insertion is the linea alba, pubic crest, and tubercles, and iliac crest. And the action for these are they flex the vertebral column and they compress the abdominal wall, and they also aid in muscles of the back when they rotate and for lateral flexion, and they're used in oblique curls, so that's where they get their name from. As you can see where I've circled it, these run medially. And so here is some listing of those functions and also some arrows so that it does aid in rotation. So following the external obliques, we have the internal obliques, which most fibers run at right angles to those of the external oblique, which it underlies. The origin is the lumbar fascia, iliac crest, and inguinal ligament. The insertion is the linea alba, the pubic crest, and costal cartilages of the lower three ribs. And so for this one, the function is very similar to the external oblique also, and I circled it on here for you. And so here is a picture of a pelvis, and I've labeled the iliac crest, the pubic crest, as well as the symphysis, so you can see where those origin and insertion points that I was mentioning earlier are for reference. Next we have the intercostals, which like the obliques kind of go hand in hand. So first, the external intercostals are 11 pairs between ribs. Fibers run obliquely downward and forward toward the sternum. And so the origin is the inferior border of rib above, and the insertion is the superior border of the rib below. And so these pull ribs toward one another to elevate the rib cage, and that's what we use for inspiration. So when you breathe in, your external intercostals are acting as they are drawing the rib cage upward, and that is what allows us to breathe in, which is very important. So these are very important muscles, and that you can see in the photo that the fibers run downward and forward toward the sternum, which is different from how the internal intercostals run, as we will see next. Last but certainly not least, for the axial muscles, we have the internal intercostals. So as I mentioned before, these will run in a different direction than external, but their functions go hand in hand. The internal intercostals have 11 pairs between ribs, and fibers run deep and at right angles to those of the external intercostals. The origin is the superior border of the rib below, and the insertion is the inferior border of the rib above. So this is kind of just really the opposite of the external intercostals, which makes sense and makes it easier to remember in my opinion. And the action for these are they draw the ribs together to depress the rib cage instead of elevate the rib cage. So both draw the ribs together, but external elevates the rib cage and internal depresses the rib cage. And so the internal intercostals are what we use for expiration and to let air out. So also important, equally important to the external intercostals in that way, because while we have to breathe air in, we also have to let it out. Lastly, we have a picture of the rib cage, and so as you can see, for the insertion and origin for the intercostals is pretty obvious because it's just the ribs, and I circled the costal cartilages because that helps me remember, because costals and coastals sound similar. Okay, so to review everything that we've kind of been over in this video, here is a model. So the frontalis muscle would be up by the frontal bone, zygomatic is major and minor, right there by the cheekbone. The depressor and levator muscles are by the corners of the mouth, and then the masseter on the cheek. Okay, and here we have one of the easiest muscles to see on the model and one of my favorites, the trapezius, very large right there. Lastly, some abdominal muscles. We have the rectus abdominis with the linea alba and the tendinous inscriptions. We've got internal intercostals and external intercostals. And then it's kind of hard to see on this model, but we've got the area where the internal and external obliques are located. Thank you for watching. I hope that this video was informative and is useful for studying the axial muscles.